All right, good morning. I'd like to call to order the special meeting of the Lee County Board of County Commissioners for April 28th, 2020. The time is 9:30. Please rise for an invocation and the Pledge of Allegiance. Heavenly Father, we just thank you so much for the opportunity to come together this morning. God, we pray that you will protect our first responders and the people who are working in the healthcare industry right now, taking care of all of those who have been stricken with COVID-19 and the many other diseases that are out there. Father, we just pray that you will guide them, that you will provide them strength and encouragement through this time. Father, we pray that you'll guide our decisions this morning, that you would give us wisdom to make the right decisions on behalf of the people that you've called us to serve. In Jesus' name we pray, amen. Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. So, last week the Board of County Commissioners took the first step and we opened a limited number of trails in Lee County. We also opened a limited number of parks in Lee County as well. We had success in keeping the crowds down on those trails and on those parks. And what we really observed was people going out and enjoying the outdoors, but abiding by the CDC guidelines and all the things that they need to do to protect themselves from COVID-19. And so now a week later, I believe it's time to talk about taking another step. So today our staff intends to present to us what they believe that next step should be at our parks and also what they believe the next step should be at our beaches, which have been closed. So I'll turn it over to our county manager to present those recommendations.
Thank you, Mr. Chair, and good morning, commissioners and everyone. As we all know, the COVID-19 pandemic has required all levels of government to create and implement policy in an effort to protect the public, and I'd like to provide a rundown of recent actions for context this morning before we begin our discussions. As you know, Governor DeSantis declared a state of emergency in Florida on March 19th, followed by the President declaring a national emergency on March 13th. Governor DeSantis on March 9th. As the County Commission declared a state of local emergency on March 17th. The executive orders issued by the governor that followed placed a great many economic restrictions on both the public and private sectors, and it's important for us to recognize that the authority exercised by the governor is considerably different than the authority exercised by the County Commission. I know you've had many emails, as I have and others, asking you to reopen businesses, and that is simply not within the authority of the County Commission. That is an authority retained exclusively by the governor in this case. K through 12 schools and all universities in the state system were closed and will remain closed through the end of the school year. By executive order, the governor designated businesses to be both essential and non-essential. In some cases, executive orders modified business operations and then closed them altogether. Initially, restaurants were restricted to operate at 50% capacity and all bars were closed. Shortly thereafter, restaurants were closed except for takeout and delivery service. As I said, all levels of government have created and implemented policy. And for Lee County, what you have the authority over, many actions were taken from earlier in the pandemic here locally to just as a week ago even. Initial goals were established, policies that created social distancing, reduced person-to-person contact, and reduced touch points. For example, we closed down public-facing lobbies, recreation centers, libraries, and other areas and services in which people had to interact closely. We did this not just to slow the spread, but also to help reassure the healthcare industry that resources would not become overwhelmed. The original estimates of the number of people to be hospitalized would have overwhelmed intensive care units, the number of available respirators, and hospital rooms. Today, Lee Health is operating at about 60% capacity. They have sufficient ICU beds, respirators, and hospital beds in general to deal with this pandemic and any spike that may follow when we get back to normal. Public compliance with CDC guidelines has improved since our first emergency board meeting during this pandemic. with early Lee Health predictive models suggested that public compliance was around 35%, and today it is at 50% or higher. We believe it's because of effective communications and messaging that we have created and used here in Lee County, along with the messaging from public and private partners, and we are grateful to residents for their compliance. You will recall that the CDC produced state and regional gating criteria that states we should satisfy before phasing in reopenings. It speaks to symptoms and cases and downward trajectories. It is a term used frequently. Downward trajectory in influenza-like illnesses reported over a 14-day period. Downward trajectory in COVID-like symptoms over a 14-day period. And downward trajectory in documented cases of test positive for the coronavirus for a 14-day period. I spoke with the Florida Department of Health Administrator in Lee County over the weekend, Angela Smith. She's taken a hard look at the dates April 12th through 26th, as she calculated a positivity rating for Lee County for the last 14 days at 9%. One of the data points we use to help form policy recommendations is the number of patients that are tested and the number of patients who test positive as a percent of the total, which is the positivity rate. There's no exact number to aim for, but there is a guiding principle. That previously mentioned 10% rate or lower is a benchmark based on recommendations from the World Health Organization. Now, you may recall last week on Thursday, April 23rd, there was a spike here locally with 105 people reported as having tested positive. That, in fact, was a result of 2,000 tests being reported by Lee Health to the Department of Health that day. And that depicted a very large one-day increase in the number of positive tests. That's not an accurate indication of the number of people who tested positive on any given day. In fact, the problem was just a technical glitch in the communications between Lee Health and the Department of Health. Also, more testing continues to be rolled out. You may have heard the governor's Monday morning press conference when he talked about drive-through testing and increased ways to make testing accessible. The county has entered into an agreement with Walmart for a drive-up location in Lehigh Acres, a community in need of more testing options. With all that context in mind, that's why we're here today. We did partial reopenings of trails last week, and it went well. We saw continued responsibility on the part of the public. People continued to observe CDC guidelines. So, as you anticipated, and we stated last week, we're back here to discuss another phase of the openings, including beaches and more parks. We've used guidelines established in coordination with Collier County, including their Sheriff's Department and the Lee County Sheriff's Office as well. Additionally, Sarasota and Charlotte County opened their beaches on April 27th. So today, I'm recommending the following to be effective Wednesday morning in Lee County. That we reopen all county parks and Conservation 2020 preserves, including all beaches and beach access points, parking, and freestanding bathrooms. This offers a much-needed recreational outlet for residents. Particularly because tourism season is over, there's even more opportunity for self-distancing at these parks and beaches. We are recommending opening the freestanding bathrooms and parking lots at our beach sites because those are facilities where people travel to. By opening parking lots, it will avoid the parking nightmare for law enforcement, parking on private property and blocking accesses. Restrooms will be cleaned routinely throughout the day by either contract cleaning or park staff. Parking machines will have staff attendants to clean them all day long. Social distancing and education will be reinforced by signage and additional staff within the beach and parking systems, and normal operating hours will be maintained so to spread out the use instead of forcing large numbers of people into smaller blocks of time. The following amenities at all park locations we are recommending remain closed: playgrounds, pavilions, recreation centers, soccer, lacrosse, and football fields, basketball courts, piers, and splash pads. Baseball and softball fields would reopen with the following caveats: no league play and no access to dugouts or bleachers. These fields would be for groups of 10 or less, priority given to the groups who previously scheduled with park staff. Hash marks on the walkways of high-use tennis and pickleball courts and other areas would be placed to help guide the public if there's a waiting line. All dog parks would reopen with no provided seating areas. Patrons would need to bring their own chairs. Pre-established social distance spacing would be identified by park staff. Patrons would have to take their chairs home when they leave. All parking fees would go back into effect under this reopening to help with congestion and turnover that occurs at all of our high-use park sites with parking fees. Park employees will continue to monitor, to educate about social distancing and CDC guidelines. Normal operations in all parks and beaches are recommended, with the normal dawn to dusk schedule. The sheriff has agreed that he will assist the county with monitoring, educating the public at our beaches, just as he did during the initial beach closings. Additionally, with regard to libraries, we would like to recommend that effective Wednesday, we're recommending a rollout plan for citizens to pick up materials previously placed on hold. This will be a contactless pickup format. First phase would include Cape Coral, Lakes Regional, North Fort Myers, and South County. Services would be offered from 10 a.m. to 4 p.m. Monday through Saturday. And the next step, would evaluate the process and make adjustments as necessary. And assuming all of the logistics are working well, we would extend that service through other library sites as well. And one last thing, your advisory committees have all have not been meeting since this event began. So we're recommending the continued suspension of advisory committees through May 31st, with the exception of Construction Licensing Board. This body reviews and approves all applications for local certificates of competency, which a construction contractor or a subcontractor must obtain in order to legally provide service. The committee would meet here in chambers to provide enough space to maintain social distancing protocols. And with that, Mr. Chair, we have included in your packet all of the recommendations that I have just read to you, along with a list of the beaches and beach accesses in parks that will be open, along with the restrictions that I've mentioned as well. Thank you, Mr. Chair.
Thank you, Mr. County Manager. And again, we created basically the Lee County Beach and Park guidelines that we've got displayed on our screen up here. And these mirror, you'll find, the CDC guidelines, but these are the expectations that we expect for folks who are going to go out and enjoy the beach and the parks, just to kind of help them understand how to protect themselves as they venture out and do these things. And basically, those recommendations are that all individuals, when in public, should maximize physical distance from others and maintain a minimum of 6 feet. So this is going to come with an adherence still to the social and physical distancing. A good way is if you're on the beach with people who you live in the same house with, you can be close to the people you live in the same house with because you're close to them at home. But you should keep your household separated from other households by about 6 feet. Social settings of 10 people or more should be avoided where appropriate, or where appropriate physical distancing may not be practical. So basically what that means is no parties in the park and no parties on the beach, and that's actually going to make it really easy for our park staff and our sheriff's deputies to see. If they see a large group congregating, that's probably where they're going to go over and talk to people and educate them about what the guidelines are. But if they see a husband and wife laying together on a beach towel, they don't need to be, the sheriff's deputies don't need to even get involved there. They don't need to become the social distancing police in that scenario. They work really hard for us, and we don't need to make their jobs any tougher. Vulnerable individuals should continue to stay home. That's our recommendation, and that's actually the recommendation of the CDC too. So if you're somebody who, falls into that category where you're in the vulnerable population where you would not do well if you caught COVID-19, you should still continue to protect yourself by staying home. That's the recommendation. And obviously, the hygiene techniques that have been gone over so many times, the hand washing, don't touch your face, don't touch, don't sneeze or cough into a tissue, and finally, stay calm, stay kind, and stay safe. I think that is a really important thing to say because, I think this has been a stressful experience on all of us, and I think we've seen some people, maybe lose patience with each other throughout this, and hopefully by getting outside and getting some fresh air, people will have an opportunity to kind of decompress and get that break that they want to. The one thing I want to make really clear, though, is this is not a mandate to go to the beach, okay? No one is required to go to the beach. If you feel uncomfortable with the idea of people at the beach, then you're absolutely welcome to continue to make that personal decision to stay home and not go to the beach. You can protect yourself. In fact, you could even make a personal decision to not allow people who've been to the beach to come near you as well. So those are things that you can do to protect yourself if this is a decision you would disagree with. And so with that, commissioners, we've got the recommendation. I'd like to go ahead and ask our staff any questions that we have, and then I'll take public comment, and then we can discuss. Commissioner Manning?
Are we allowed, Roger?
Sorry,
Manning and then Mann. Go ahead, Manning.
Manning.
Are we allowed, Roger, I know this is unincorporated Lee County. Are we allowed to pick and choose what beaches are open? I sent you an email that was sent to me. So,
Commissioner, the short version, well, actually, let me defer to the county attorney for help in this answer. I believe I know the answer, but
Go
I'd
ahead.
rather him take the heat.
Yeah.
Commissioners, interesting question, given the overlay of the apparent regulatory authority of the town of Fort Myers Beach. I would suggest to you, however, that you are wholly within your authority to open up the county facilities along those beaches. I have some reservations about the regulations that were put in place by the town as to their constitutionality. I need not get into that right now unless pressed, but I would suggest to you that you are within your authority to open up your parks. I would also remind you that the law in the state of Florida is that the beach area seaward of the mean high water line is owned by the state of Florida and trust for all the people. So there's also the question of our ability or even the town's ability to regulate state property. So with that caveat, you're free to move forward.
Boca Grande asked me to let them stay closed for 2 more weeks. Is that allowed?
Go ahead.
Chairman?
County Attorney.
Not having heard any rational basis for that, I would suggest not. You run into questions of equal protection in that scenario, which is also one of the difficulties I have with the town's regulations. Similarly treated people or similarly situated people should be treated similarly, and I've not heard a rational basis to treat the people of Boca or, quite honestly, the residents of the town any differently. If I may, just one additional point. One issue that I think I have with the town regulation is also the fact that it's not reciprocal. And by that I mean there's not a requirement that town residents stay within the town city limits. So while they're looking to ban people from coming into their town, there's no prohibition against their residents going out of their town and perhaps bringing COVID back in. So I think that's certainly an equal protection issue that they need to deal with.
Thank you.
Commissioners, what other, Commissioner Mann, you had a question?
Just a clarification on the libraries. They'd be open from 10 till 4, but not for normal activities. Explain the limited activities that would be available.
Mr. Chair, I'd like to ask Chris Brady to come to the podium and help with the answer.
My concern is that the announcement that they're in fact open anyway from 10 to 4 might just be a wide open door for folks, but there seems to be a restriction on this.
Yes, sir. Good morning, Commissioners. Chris Brady for the record. What we are proposing is that starting tomorrow, it will just be Cape Coral Lakes Regional, North Fort Myers, and South County, and that is, they'll only be open to pick up materials that are on hold. So if a citizen placed material, a book, on hold, they will be able to come in and there will be a contactless exchange of materials. So the library...
Is that something they've done online or on the phone? Or?
That's something that they've done either online or on the phone. So book returns are open. We did open those back up last week. This is just for them to pick up material that they've placed on hold.
This is not for folks to come in and browse and...
Correct. The libraries themselves will still be closed for the citizens coming into to browse, to use computers, to look at other material.
Okay, one other question that's not library related, but you might know the answer. I just need a reminder as to who is a vulnerable citizen. Is that definition published somewhere?
It's, Commissioners, I don't have the exact language with me, but the definition by the CDC talks about people who are 65 years old and older, those with underlying medical conditions that would otherwise make them more vulnerable to the virus.
So for the beaches, this I guess back to Roger, 65 and older, your language says they should remain at home. So what is the bottom line, or maybe we need to kick this back to Honorable Counsel?
Well, I think it's a recommendation, Commissioner Mann. It's not a prohibition. Richard, if you want to talk about that too. This was a guideline that the CDC has put out that is a recommendation that you should still protect yourself. I mean, quite frankly, the 65 and plus crowd is the crowd that would have the worst outcome with COVID-19. That's well documented.
You don't know anything about old folks. Don't lecture to me about that.
Damn right.
But I have a
All right,
couple
any other
that-
questions? Commissioner Sandelli?
Mr. Chair.
Go ahead. Commissioner Sandelli, and then we'll come back.
About being old?
Yeah, go ahead. Commissioner Sandelli, you had other questions.
I had some comments. Do you want me to wait until we move to a vote on this?
Yeah, you could do them now or you could do them later, whichever you prefer.
Well, first of all, I wanted to thank everybody for the sacrifices and everything that people have made, since this whole issue came up. I think it's a tribute to who we are collectively. With that, I think we put ourselves in a position to go ahead, and I think that's the way it should be. How do we do that? I've looked, as I sat down and put pen to paper last night at a late hour, we talk about a phased approach, and I'm all in favor of that, and I think we've taken some steps with that. I want to be consistent and fair with everybody. I think we need to be rational, use some common sense in this, and continue to encourage cooperation going forward. So with that, I agree with opening our parks, as was laid out here. I think that's been overdue a little bit, and people really are anxious to do that. I got a lot of feedback for that. And I think restricting away from areas that gathering, I think, is certainly appropriate. When it comes to the beaches, I kind of look at that in the same way. I think that we should provide parking. I think we should provide the restrooms and so on and so forth. My only difference is I think that I'm all for opening it up tomorrow, but I would put the same restrictions on the beach as I would put on the parks. And that's open for exercise, for walking, and that type of thing. And look at that over the next week. And if everything goes well, if everybody is out enjoying it, and we feel we can go the next step, I would prefer to do that personally. I think that plays into the consistency, and I think it plays into the phasing of the responsibility. So that's my only difference in that.
Okay. Mr. Pendergrass, you got anything?
No direct questions to Roger. I think most of the questions have been answered already. I want to thank our staff and everybody. Like everybody said this morning, this is something we did a 180, a month ago when this all happened. Thanks staff for the great job you've done together, putting this together. And I look forward to supporting this recommendation today. I think as a community, we've all come together. We made a difference. We showed the models they're not accurate based upon our actions here locally, and we'll support the recommendations here today.
Commissioner Sandelli?
I have one more thing, and I think this goes to the other side, is that by bringing people, opening this up and having people go to the beach and whatever we decide on, I would really like to see if we could get our restaurants provide outdoor seating. I think that's the first step in that phased approach. If they can do that, there's more people to the beach. They might be able to increase their business a little bit, and the next phase for them is obviously opening inside. So if we can consider that, it would be great.
Do you want to address that, Roger?
Yeah, thank you, Mr. Chair. Commissioner, I think it's a great idea. It will, whether or not we can do that will depend on what the governor does in the next few days. You know, his executive order that closed the restaurants and took other actions is set to expire on the 30th, I think at midnight. And so on the 1st of next month, if he has not extended that executive order or has not modified that order, I'm going to refer to our county attorney, but I believe that restaurants would then be allowed to open. Richard, is that correct?
Yeah, go ahead.
Yes, sir. In the absence of any extension of the executive order, restaurants would then be subject to local control, if any, and so far we have not imposed any local controls. Therefore, by default, they would be able to open.
Okay. Very good. Does that answer what you were
Yes,
looking for?
thank you very much.
Okay, very good.
If I could, Chairman, I also want to add, we're talking about the age restrictions, the 65, and who's vulnerable and who has underlying conditions. At the end of the day, everybody has a choice. If you're 18 or 65, you have a choice. So if you choose not to go to the beach, you can stay home. Or if you choose to go to the beach, if you're 18 or 65 or 75, you can go to the beach. Because I know I've been contacted, a lot of residents are over 65 that says they won't have a choice. They have a constitutional right to enjoy these properties, enjoy their life, and this is what we should look at, what is constitutionally allowed under our Constitution.
Amen. All right, let's do this then. Let's go ahead and take public comment before we get into any motions. The first person I'd like to call is Fred Forbes. When you come up to the podium, again, you don't have to touch anything on the podium. It's all set up so that you can just talk. And after Fred Forbes will be Loretta DeRoge.
Yeah, good morning, and I'm here actually as Fred Forbes. I am a city councilman, but I'm going to give you my opinions. First of all, I think you're absolutely on the right track of opening up the beaches again and also the parks. And I want to say I have more good news and bad news to give you. First of all, the graphs that we have been using to say whether we should open, we get that 14-day. The way they're done, and this is an IT problem and a statistician's problem, they're overly pessimistic on the downhill. The reason I'm saying that, you all peaked roughly around the 4th or the 3rd of April, and the number of cases you had at that peak that were tested and all that was a lesser number than you have out here. As you go out away, we're on a downhill run. You're actually testing more people, which should produce more cases. So the fact that the bars are going down is good, but they actually, if everything was based on the same number of cases a day, the slope would be much more dramatic going downhill. It's better that it's presenting a pessimistic case as opposed to an overly optimistic case. Another point I wanted to make, Dr. Nicole Sapphire on national TV, who is a doctor in a Manhattan hospital, works in the intensive care part of the virus crisis center. According to their statistics, 94% of the deaths in New York City were because the people had that extra thing that the manager was talking about, and they had other health issues. No matter whether they were young people that died, middle age, at 50 plus, 67, whatever, they actually had an issue. The other thing I wanted to tell you to focus on is that you're about to go into the reopening. There's lots of people right now working successfully through the crises, manufacturing, delivery services, repair services, construction services. They've had very little trouble with people getting infected. Get those people in, some of those companies in Lee County, let them share publicly some of the things they've been doing to minimize their employees coming down with the virus. That should be helpful to everybody. One other thing about restaurants, The ones that have outside dining will be the more popular places. So we have a lot of restaurants that don't have outside. So if you can think about temporarily relaxing so they can set up some temporary dining in parking lots and on sidewalks, only for a period of time, because we're out of the high season, so they don't need all that. I think I've run out of time. Thank you very much. I left you a paper with all this. If anybody has a question, they feel free to call me.
Thanks, Mr. Forbes. All right, Loretta DeRoche, followed by Donnie Overholzer.
Loretta DeRose,
Ma'am, please stand behind the podium and address the commission. Thank you.
I'd like to address the beaches. I think it's a very important item that you do open up the beaches. I've been walking along the streets, and I find once or twice you're walking 6 feet apart along the street, cars can't get by. And once a car, he didn't blast his horn, but he blew his horn, kind of scared me. So I kind of like jumped off and almost twisted my ankle on the walkway. I think it's safer to walk along the beach. And Ray, we just met today, and I understand you are my district representative, but I disagree with you already. Okay. I think that we should be allowed to sit on the beach. I am over 65, and I'm not going to tell you how many years over 65. However, when I go swimming in the ocean and I'm a swimmer, I'm tired. I want to come out and I want to sit on a towel. I need to rest. If I'm going to take a 20-minute walk along the beach, I'm going to want to come back and just sit on a towel. I don't mind sitting 6 feet away from the next person. That's not a problem. And I don't think sitting should be considered a problem. I think we can all sit, at least sit, beaches are big, we can sit 10 feet away from each other. But if you're going to go in the ocean and swim, I get tired. I'm going to want to sit. I'm not as young as I used to be. What else did I want to say here? Oh, testing. I believe I have had the coronavirus in February in Colorado. And I didn't go to the hospital because I had this great guy over there to take care of me, but I had all the symptoms. And I was stuck overnight at the Denver airport coming back from Florida last February 7th. And I think that's where I picked it up, because I had Asians there, I had Europeans there, and the whole airport was shut down. I-70 was shut down due to avalanches, so I was stuck there with a whole bunch of people. And I think that's where I picked it up. But I can't get tested for the antibodies. And if I do have the antibodies in me, I'm a pretty healthy person, I'll be very happy to donate blood for people who need it. But I can't get tested. You need to get the testing for antibodies. I was tested negative for the virus. That's easy to do. So I don't have the virus now. But I'd like to get tested for the antibodies and donate blood because the hospitals need it. That's another important thing I think you should do. Am I out of time yet? Oh, and I agree with the restaurants opening. I don't even mind opening up inside. They can have tables, every other table, sit 6 feet apart. The waitresses can have a mask on. They can do the rubber glove thing, and that's fine. But restaurants have got to start making money. I have a business. It's not in Florida. It's in New York, which is my other residence. I don't know how I'm going to pay my real estate taxes. I'm not open. I'm down, I don't know how many hundreds of thousands of dollars. And the end of May, second half of your taxes are due. I don't know how I'm going to pay them. My insurance is due in June, another $25,000. I don't know how I'm going to pay it. We got to get businesses open. People have choices. If you don't want to go out to a restaurant, you can stay home. Like you said, it's a choice thing. If you're healthy, which I think I am, and I want to go to the beach, even though I'm over 65 years old, I should have the choice.
Thank you, ma'am, for your time today. Thank you for your comments as well. All right, Donnie Overholzer, followed by Ole Gonsholt. After Donnie. Yeah.
Donnie Overholzer for the record. I just want to thank you now, since I know that you're going to pass this motion, hopefully, to allow the ball fields to open up, because that was the reason why I was here last week, and I just want to thank you on behalf of especially all the kids in Lee County that I've spent most of my life working with. It's going to be a great opportunity to get these families out in a safe manner, and I just want to promise you my facility is in the city, but the city does kind of go along with the county guidance, so I'm going to do my best to make sure that you have our faith that we will make sure that things are done in a very, very safe manner, and that we can continue to stop the spread of the disease. I will do everything in my power to make sure it's very safe for our families. Thank you.
Donnie. All right, Ole Gonsholt, followed by Bruce Thomas.
Yeah, I like to look at the whole restriction and situation from a common sense point of view. And when we go to supermarket, go to Lowe's, there's no way to comply with what the restriction is for social settings of 10 people or more. If all little shops and businesses were open, the public would spread out a lot more than they are able to right now. So the sooner all shops, all businesses, all restaurants are open, we can still comply with the minimum of 6 feet distancing, but vulnerable individuals obviously have a choice not to go to those establishments, whereas healthy people are suffering, and businesses, of course, are suffering even more. So the sooner everything is open, I think the public at large will be better off, and of course the businesses will be better off. So that's pretty much my sense. Thank you.
Thank you. Thank you for your comments this morning. Okay, Bruce Thomas, and that's the last card that I have. Okay.
Mr. Chairman, good morning. During World War II, Count Ciano, Mussolini's foreign minister, wrote in his diary, "Victory finds 100 fathers, but defeat is an orphan." COVID-19 virus is an invisible enemy that has claimed the lives of 37 Lee County residents out of a population of over 770,500 people. In reaction, state and local government closed 90% of the businesses in this county and closed our public schools. Many are now saying the cure is worse than the illness. So until a working vaccine or therapeutic is developed, what is the cure going to be? The cure is courage, forward-thinking courage, problem-solving businesses, and teachers willing to teach our children in classrooms throughout the county. We have city policemen, county sheriffs, firefighters, paramedics to face this crisis in this county every day. Surely the parents of this county, the business people of this county, and the rank and file workers of this county can face this vicious enemy by getting back to work. Step one, we need to carefully reopen our public parks, including bike riding. Our public swimming pools also. Tennis courts and pickleball courts. We can open our county parks smartly, have 6-foot spacing, abide by CDC guidelines, have proper supervision of our children at the public pools, and proper supervision of our beautiful parks. Mr. Chairman, we can do this. We're Americans. We're Floridians. In conclusion, let's open our public parks in this county. Let's get Lee County moving forward. Victory. Thank you, Mr. Chairman.
Thank you. All right, let's ask for Mayor Kevin Ruane to come speak. And then does anybody else wish to speak this morning? Anybody at all? Raise your hand if you'd like to. Okay, then Mayor Ruane will be our last speaker. Thank you very much.
Good morning, Commissioners, county staff. I appreciate all you've done. First and foremost, I think it's important for the public to realize the collaboration that we have actually endured and actually put in place during this process. The county manager with all the city managers have talked on a daily basis. The mayors, as well as your commissioner, your chairman, Brian Hammond, we've talked on a daily basis. The collaboration working together is what we're showing the public here in Lee County. We're looking for their interest, the best interest possible. Along the same lines, I applaud you for explaining the spike, if you will, in what took place. Many people looking at the stats and look at that. I look at one, and most people that know me, I'm a data person, and we look at April 4th to be really where we had our most cases, and since then, if you can obviously understand the spike that took place, we actually have been flattening. I think it's important if we come up with simple ways of having a scorecard. Stats are flat. Positivity rates are flat. Testing is increased. Those are all things that I think people have metrics to identify. So I applaud you. Secondarily, when it comes to the beaches, we've had many conversations on the overlays. Sanibel has a couple of complications with beaches. One, we actually, on behalf of the county, manage Turner Beach for you. And Turner Beach is something through Captiva. Secondarily, my understanding is Bowman's Beach is a state park, yet the county rules apply. So if you are going to move forward with obviously open the beaches, and I believe you are, we want to work in conjunction with you. If we believe in social distancing, and we all agree that's necessary, opening all the beaches, we're obviously going to add to that. So if we open Turner, we open Bowman's, you know, I think it's imperative as a mayor of the Sanibel to look at opening the other beaches. Why? I allow people to spread out more, have an opportunity to see this, we do, you know, and really employ the social distancing that's taking place. I also think it's imperative for people to get back to work, okay? I appreciate sitting and listening to what took place 6 weeks ago in these chambers, but the modeling and the forecast were not there. We live in Lee County, and I think what we need to do is now recognize the data that's been here. We need to get open, because honestly, we need to get people back to work. There's not enough money for PPP, there's not enough money for unemployment, and municipalities, okay, that we actually do. People want to pit what is known as life against the economy, or life against money. They're intertwined whether we like it or not. Because honestly, without money, we don't have government. And without government, we don't have resources. So it's essential that we do one in this, and this is something we're going to have to learn to live with. I employ us to do everything that's safe and take every precaution necessary. But I think we can look at this, as I would like to say, and many of you heard me say, we're not putting the light switch back on, we're putting a dimmer switch and dimming and turning a dimmer switch in that order. And I think it's essential we do so. I appreciate your considerations, I appreciate all your hard work, and I really have enjoyed the collaboration. I can't thank you enough.
Thank you, Mayor. Very good. All right, so that closes public comment, and back to the commissioners for discussion. Mr. DeJoly, real quickly, did you want to just address the Bowman's Beach and Turner Beach idea? I mean, it seems like your recommendation would be to open everything to allow for people to be able to spread out over all the beaches, correct?
Commissioner, that, I don't think a explanation beyond what you've just said is required. That's accurate.
Perfect. Okay, very good. What other questions do we have, Commissioner Pendergrass?
So on that, on those recommendations for like Florence Beach, they're actually took yesterday, which I think we all have concerns with that, the constitutionality of that. Would that open that up then, so there would be no regulations of who lives where when they go to the beach for their own access points?
Commissioner, that would be correct.
I just want to clarify that. And also, we don't specify tennis and pickleball in our public pools, or are we any actions taken on that?
Dave, will you help us with that explanation, please?
Yes, thank you, Mr. Chair. Commissioner, we would have tennis and pickleball. We would put lines, 6-foot spacing lines on the ground so people would know to keep the social distancing. Pools would stay closed at this point. That would be our phase 3 approach.
And Commissioner, on the pickleball, the 6-foot spacing would be for those waiting in line for their turn on the courts.
Okay, so pickleball will be open tomorrow, just with some spacing for
Yes, sir.
people waiting in line. Now, so what if the governor's order tomorrow night expires? There's not a new order provided by the governor at midnight on Wednesday night. What happens then to, businesses will open back up, but our pools then, what timeline will we be looking at those pools?
Commissioners, you still have the authority over any of the properties owned by Lee County government, and by local regulation, you can make those adjustments.
Would you make that based upon the emergency declaration order? Would you just open the pools automatically then? Work with Parks and Rec staff?
Commissioner, we have designed these recommendations in multiple phases, and I think the pools are in the next phase. With the recommendations today, and if you approve them, the caveat is that depending on how this goes, how people behave and keeping social distance and doing all the right things, these could be modified and we could end up going backwards. So we'd like to, before we make a recommendation on the pools and a couple other things, we'd like to wait and see.
Why I'm asking is because a lot of the private communities, HOAs, they actually look at the county's regulations based on what we're doing, so they're kind of waiting to see. Some have opened up voluntarily, and some are also still waiting for us to take action. I think there's a word about liability. They're kind of following our model, and that's why I was asking about the pools too. Okay, thank you.
All right, does anybody wish to make a motion?
I'll make a motion. We follow the county manager's recommendation to open the beaches and the parks and libraries under the current recommendations.
Okay, do we have a second? We have a second for, okay, we have a second from Commissioner Mann. Very good. All right, do we have any discussion on the motion on the floor? Commissioner Mann, go ahead.
I just want to point out for the record that within the last couple of weeks, my office has received a paucity of public input regarding this whole matter of shut down, open up, when do we do which, and how much at what time. I've probably received less than 24, most of which are supportive of what we're doing, but the others have suggested that we open up in some orderly fashion. But I think for the most part, the Lee County citizens have been very strongly supportive of the action taken by the commission so far. The only time I've been fussed at, frankly, was in Publix when I went the wrong way down a one-way aisle. And a lady made certain that I understood that I had violated some new edict, and I should be ashamed of myself. I didn't tell her that I was a public official, and I apologized, and I did a U-turn. But the public is very supportive of what we're doing, and I'm not seeing a huge demand to undo what we've done. The gentleman pointed out that there have been 37 people have died in Lee County. Well, a week ago when we were meeting here, there were 25. So we are not out of the woods yet. And I think safety has still got to be our watchword. I think what the county manager is suggesting here is reasonable and makes sense under the circumstances that we find ourselves in. And that's why I'm supportive of his recommendation here. Thank you.
Any other comments? No? Any comments from over here? No? All right, well, if there are no further comments, then I'll go ahead and call the question. Are there any objections to the motion? All right, seeing no objections, then the motion carries unanimously. All right, thank you, Mr. County Manager. Can you kind of outline what the next steps are from here then? What can we expect?
So, Commissioners, the recommendations as we've made to you today with the openings of the parks and beaches will take place tomorrow morning during our normal working hours. Beaches are, sun up to, dawn to dusk. And the parks operating hours are all listed on our website, the individual parks, and we'll be ready to go to work.
Excellent. You know, one thing I'd like to just point out, I think it's important that that people who live in Lee County and want to use the beaches and park facilities have the same understanding of how the rules will apply uniformly throughout the county. I think obviously Fort Myers Beach took action yesterday to adopt some rules that are different than what we've adopted. Commissioners, with your permission, I'd like to reach out to the mayor of Fort Myers Beach and ask them to adopt what the county commission has put in place today so that people who go to Fort Myers Beach would have an understanding of what's expected of them. Does anybody object to me reaching out and making that request that they get on the same page with us?
Please do. Please do.
I think consistency in our approach here is very, very important.
Okay, excellent. And no objections from over there as well. Okay, very good. Yeah, again, this has been a great meeting. There's no other business before us today then, Mr. County Manager?
No, sir, thank you.
All right, well then, seeing no other business.